Recent studies have shown that gender-based violence has an impact on the country's HIV and AIDS infection rate. In a recent panel discussion at the International AIDS Conference, Health Minister Dr Joe Phaahla revealed that approximately 20 to 25% of new infections in young women have some kind of link to gender-based violence. For more on this, the Minister joins us via our video link to expand on what else they've found. Minister Phaahla, it's great to have you on the program, sir. Thanks very much indeed for your time and patience. It's really concerning this correlation or causation that we're seeing, because on the one hand, South Africa has in fact made strides in reducing the rate of new infections in the country, but instances of gender-based violence are threatening that.
Definitely, that's what we have found out, that our biggest problem currently is that because to reduce the burden of HIV and AIDS, it's not only in terms of getting more people to test and be put on treatment so that their viral load can be suppressed and so that they don't transmit, but also in terms of the future, the most important thing is stopping new infections. And what is quite clear is that the higher spread is amongst the young people, and young women account for the biggest proportion of new infections. Now, we have now also then found out that the new infections is not only in terms of sexual activity early in the teenage period, but it's also driven by gender-based violence. A lot of the transmission relates to sexual relations where the young women are being coerced into early sex by older men. So that's why the linkage between GBV and also with the spread of HIV, especially amongst young women.
Really sad, this kind of development or discovery. Let's speak to us a bit more, Minister, if you can, about this HIV and GBV link, because my understanding is that in some instances, what you're finding is that victims are actually, victimized by several perpetrators, and this contributes to this particular link.
Well, again, it relates to the problems in our society. As we know, my apology, there's another, as we know that on the GBV and femicide level, we know that unfortunately our country, is recording one of the highest in the world in terms of gender-based violence, including also with the femicide. Now, because of that, that social challenge in our community of these high rates of gender-based violence, a lot of it, it's also leading to, because what it means is that in most of those cases, it's not just physical violence, it's also sexual violence. This macho men dominating women and using their masculine power to overpower the women, and in that process they also transmit the HIV virus, unfortunately. So the linkage is quite clear in that regard.
Yeah. What is also interesting is, scholars are now admitting that it's quite difficult to really define gender-based violence. It's described as a complex phenomenon, because typically, even perhaps in the context of our discussion, people think of it as sexual violence, in some instances physical violence, but it manifests in other ways, such as emotional and non-physical violence.
Well, definitely. I mean, you can imagine more than just the physical trauma. It's more than the physical trauma. It is also the mental and psychological trauma which this leaves in the victim. I mean, I'm sure if with the recent reports of this incident in the Krugerstop, mine area, I mean, that's just really the worst picture of what we are dealing with. And you can imagine the kind of trauma which, so that's why the issue of mental health is also, linked to the issue of GBV and also leading to, the spread of HIV. But the mental health, burden as a result of that is just uncalculable. So, and that's why it's a matter which all of us, it's not just a problem of which the government can be able to deal with, but all of society. We have to redouble our efforts in terms of the elimination of GBV and femicide.
Yeah, speaking about those efforts, let's talk about national strategies and targets. I mean, so much time has been spent in the recent past speaking about the 1990 target, which, you'll correct me if I'm wrong, was the aim for 2020. I wonder whether or not we were able to reach that target, and if not, how far we are.
The target was this year, actually, 2022, that we should have reached the 90% of citizens knowing their status, and 90% of those who know their status, if they are positive, making sure that they are on treatment and they remain on treatment. And the last 90 is also as a result of that, making sure that 90% of the people who know their status who are on treatment are also virally suppressed, so that they don't spread the virus. We were already struggling to achieve that target before the COVID-19 struck. Already by late 2019, we could realize that only a few districts in our country were anywhere closer to reaching that. But once the COVID-19 pandemic came on us, and there was all the restrictions, including the early lockdowns, a lot of people, lost their follow-up to treatment. And even as the services were reopened, even the community services, but not everybody came back onto treatment. And also in terms of continuing to roll out, encourage people to come for testing, all that, the whole work of, attracting more people to come forward to be tested, put them on treatment and keep them on treatment, all that work, suffered, especially the major part of 2020 and early 2021. So over the last part of last year and this year, we've been embarking on the recovery plan, Welcome Back campaign. So at the current moment, there are only just about 10 districts out of 52, which some of whom have already reached all the 390s, but some in the first 90 and in the last 90. But the difficult one, because of these lockdowns, is the middle 90, retaining people on treatment. So that's what, basically ourselves in South Africa, but in various parts of the world, we're sharing information and looking at ways in which we can increase the uptake of testing and also retaining people on treatment.
Right. Interestingly enough, South Africa is considered to generally have an HIV epidemic, but this is sometimes characterized in distinct sub-epidemics. If you can explain that for us, Minister, what that actually means and how it informs your response to this virus.
Well, the sub-epidemics, one we have already referred to, the gender-based violence and femicide. We consider that as also a pandemic or an epidemic in our country, which also limits our progress. Secondly, of course, the COVID-19 pandemic is also one which has also retarded our progress. And of course, we do have other sub-epidemics or almost pandemic, the non-communicable diseases, the high blood pressure, diabetes, all those also constitute other level of competing, epidemics or pandemics. So that's why many of, talking to colleagues from UNAIDS, partners who are supporting us, like the Global Fund, those who provide financial support, like PEPFAR, we're emphasizing together with civil society that going forward, what is important is an integrated approach. We must still be able to focus on making sure that we reduce the threat of HIV as a health threat to the world and to our countries, but also because of the other sub-epidemics or pandemics, we have to focus more on an integrated approach in dealing with all these competing epidemics and pandemics.
Absolutely, especially when you consider what's at stake. For now, Health Minister Dr. Joe Phaahla, thanks very much indeed for unpacking all of that for us. Hopefully our better understanding of these kind of dynamics will better position us to respond to the issues at hand. Joe Phaahla, once again, is the Health Minister of South Africa.